Injury and Illness Prevention Program, IIPP training. Injury and Illness Prevention Program, IIPP training. So let's start with the definition. What is an IPP? It is simply a written safety program training. It is an effective way to improve the safety and overall health in our workplace and to potentially reduce costs related to employee injuries and illnesses, including exposure to regulatory fines from OSHA. Further review of this training is to be done on your own time during breaks, lunch, before or after your work shift. This training presentation will review COVID-19 and prevention procedures, CPP, hazard communication and hazard reporting, accident reporting. All employees must also receive training before participating in work-related operations, such as in the use of kitchen equipment. Please discuss with your manager if you're in need of a specific training. In this CPP section, we briefly cover what is COVID-19 and the symptoms, COVID-19 vaccination guidelines, how employees can transmit COVID-19 at work and other places, what we can do to prevent the spread of COVID-19, what to do if you become sick, procedures related to COVID-19, procedures to investigate and respond to possible COVID-19 case and outbreak. Injury Illness Prevention Program video. So, what is COVID-19 and the symptoms?
Hello to our members, patients, and community. The 2019 novel coronavirus, which causes a disease known as COVID-19, is a new virus that causes respiratory illness in people and can spread from person to person. People infected with COVID-19 usually exhibit symptoms similar to that of a cold or the flu, such as a fever, cough, or shortness of breath. The novel coronavirus can also attach to the lungs, which can cause symptoms of a respiratory tract illness like pneumonia, including shortness of breath or difficulty breathing.
Becoming COVID-19 vaccinated or not is completely up to each individual. COVID-19 vaccination guideline. Fully vaccinated for COVID-19 is considered 2 weeks after the person has received the second dose in a 2-dose requirement, or 2 weeks after they have received the type of vaccine that is a single dose. COVID-19 vaccination protects against transmission, serious illness, and death, is a safer and more dependable way to build immunity to COVID-19 than getting sick. Vaccines can help you stay healthy so you have less chance of missing work or precious moments with your family due to illness.
The COVID-19 virus spreads mainly between people in close contact with each other. It spreads most easily in crowded settings, closed spaces with poor ventilation, or through prolonged contact with an infected person. This is because, as a person infected with the COVID-19 virus breathes, talks, coughs, or sneezes, liquid particles of various sizes are expelled into the air. Larger particles are called droplets. Smaller particles are called aerosols. You can contract the virus if infected particles come into contact with your eyes, nose, or mouth. Whether you are inside or outside, always maintain a physical distance of at least 1 meter from others. When you are in an enclosed or poorly ventilated space, the virus can spread more easily. In these conditions, aerosols can remain suspended in the air or travel farther than 1 meter. When you are inside, make sure to stay at least 1 meter from others. Wear a mask. Open a window to improve ventilation. And limit your time spent in these settings. To protect yourself and others, always follow these 6 precautions.
What we can do to prevent the spread of COVID-19. Wash hands frequently with soap and warm water for at least 20 seconds. Always wash hands after clocking in, cleaning tables, surfaces, or removing used items from tables, taking breaks, and before preparing and serving drinks. Wear a face mask if needed. We can also practice physical distancing, wash hands after serving ready-to-eat type food, reduce population density indoors when possible, implementing separate shifts and or breaks times for staff, restricting access to work areas to employees only, frequently disinfecting work areas, tables, counters, and restroom. What to do if you become sick? Employees experiencing any symptoms must leave work and get tested immediately for COVID-19 and report back to their manager. In addition, self quarantine for the amount of time the current local order requires. They also must stay home if having symptoms and or test positive for COVID-19. This also applies if a member in your household is diagnosed with COVID-19 or is experiencing symptoms. Procedures related to COVID-19. Immediately upon arriving at work, all employees must complete the health screen form. Please inquire with your manager or how to complete that form. This may include taking your temperature. If the result of your temperature is 100 degrees or greater on your health screening, please notify owners, managers, and ask for a free COVID-19 test if available. Owner manager will assist in clocking you out for the day. Leave home immediately. Always keep in communication with the owner manager during your time out due to illness. Procedures related to COVID-19, effectively identifying and responding to employees and customers with COVID-19 symptoms at the workplace is a priority. We can disclose the name of the employee who is infected with COVID-19. Notified are all employees who were in close contact with the infected employee who we recommend getting tested immediately. We have procedures to investigate and respond to a possible COVID-19 case, including an outbreak. Procedures related to COVID-19. Proper ventilation within the building is always encouraged. Must use gloves and utensils when handling or serving ready-to-eat food. Disposable gloves are available for front staff when removing items from tables used by customers. Front staff must clean and sanitize customer tables and sitting areas after each use if possible. Employees have the right to receive a stipulate for a respirator for voluntary use. Face masks are available to employees for voluntary use when requested while at work. Procedures to investigate possible COVID-19 case, documenting all the following. Date that person first had COVID-19 symptoms, date of the positive COVID-19 test or diagnosis, determine day and time person was last present at work. Management will interview person to investigate how they were infected and if it's work related. Procedures for responding to a COVID-19 case. Infected person will not return to work during infectious period, immediately excluding cases who do not develop COVID-19 symptoms. Not be at work up to 10 days after one set of symptoms and at least 24 hours have passed since fever of 100.4 degrees Fahrenheit or higher has resolved without use of fever-reducing medication. Procedures for responding to a COVID-19 case. Regardless of vaccination status, previous infection, or a lack of COVID-19 symptoms, that person must wear a face covering at work until 10 days have passed since the date symptoms began, or if the person did not have COVID-19 symptoms from date of their first positive COVID-19 test. If three or more employees have COVID-19 in the workplace, we consider it an outbreak. We immediately provide free COVID-19 testing to employees who were exposed and testing as needed thereafter. We will provide information about COVID-19 related benefits to which you may be entitled under current laws when excluded from the workplace based on COVID-19 or close contact. Employees who had close contact with an infected person will have a negative test before returning to work. Employees exposed regardless of vaccination status will wear face covering for up to 10 days when indoors or when outdoors and less than 6 feet from another person. Actions to improve ventilation maximize the supply of outside air as much as possible. In this section, we briefly cover what is a hazard communication and reporting, what is accident reporting, steps for accident reporting. Visual cues can be used to prevent hazards or even minimize the transmission of COVID-19, which includes signs and floor markings that indicate where employees and customers should be located, or path of travel, and also can be used to prevent accidents like slips and falls.
You might associate hazardous chemicals with industrial use or large spills you see on television, and that would be correct. But hazardous chemicals or materials are everywhere and are used safely every day in our restaurants by our associates. This program, Hazard Communication, is designed to provide you with the information you need to know to protect yourself from potential hazards associated with the use, handling, storing, and disposal of chemicals and other hazardous materials. Your restaurant has eliminated or restricted the use of many hazardous chemicals and continues to replace hazardous chemicals when a safer product is available. All you need to do is follow the procedures outlined in this program and take a personal responsibility for your safety and the safety of those around you.
What is hazard reporting? Immediately reporting hazards in our workplace assists in preventing injuries for both employees and customers. In an effort to correct unsafe or unhealthy work conditions, the following procedures are in place. Hazards will be documented and investigated by management, who shall review each hazard notification to determine the necessary corrective actions. Everyone must attempt to correct any hazard immediately if possible. Safety equipment such as fire extinguishers, emergency lighting, exit signs, and work areas will be inspected by owners, managers, also ensuring that deficiencies identified are corrected and in a timely manner, and that formula inspections are conducted on a regular basis. What is accident reporting? Reports give a true snapshot of what really occurred during the accident and capture the event in real time. Information and reporting on accidents, incidents, and illness can be used as an aid to assess real risks and help to develop solutions to potential risks. Helps to prevent additional injuries and illnesses within our workplace. Steps for accident reporting. Reporting an injury at work. First, assess the injury to determine the level of care needed. 911 trip to medical facility or on-site first aid. 2. Seek appropriate treatment for the injured employee. 3. Alert the healthcare provider that the injury is work-related. 4. Document every incident. 5. Report the injury to your workers' compensation carrier. 6. Fill out the first report of an injury. We thank you in advance for preventing injuries and the transmission of COVID-19 within our workplace. If you have any questions about this training, please ask your manager.